Imagine a silent, relentless enemy working within your body, slowly eroding your vital functions without a single alarm bell ringing. This isn't a sci-fi plot, it's the stark reality of chronic kidney disease, or CKD. It's a condition that affects 1 in 10 adults worldwide, yet remains shockingly misunderstood, often progressing to devastating stages before any significant symptoms emerge. We're talking about organs no bigger than your fist, tucked away beneath your rib cage, performing an indispensable filtering act 24/7. But what happens when these tireless workers begin to falter? What are the subtle whispers they send before their cries become roars? Today, we embark on a crucial journey to unmask this silent threat, exploring its insidious causes, the distinct stages of its progression, and the life-saving treatments that can offer hope. Before we delve into the disease itself, let's appreciate the marvels that are our kidneys. These two bean-shaped organs are the unsung heroes of our internal environment. Every single day, they filter about 180 liters of blood, removing waste products, excess water, and toxins, while also maintaining the delicate balance of electrolytes like sodium, potassium, and calcium. Beyond filtration, they play critical roles in producing hormones that regulate blood pressure, stimulate red blood cell production, and maintain bone health. When their function declines, this intricate ballet of biological processes begins to unravel, impacting virtually every system in the body. Understanding their role is the first step to understanding the gravity of CKD. So, what exactly defines chronic kidney disease? It's not a sudden event, but rather a gradual and often irreversible loss of kidney function over time, typically lasting 3 months or more. This decline means the kidneys struggle to efficiently filter waste and fluid from the blood, leading to a buildup of harmful substances in the body. It's a progressive condition, meaning it tends to worsen over time, and without intervention, can lead to end-stage renal disease, where artificial filtration or transplantation becomes necessary for survival. The chronic nature is key here. It's a long-term battle, not an acute, short-lived illness. The insidious nature of CKD lies in its stealthy progression. In its early stages, symptoms are often non-existent or so subtle they're easily dismissed as signs of aging or everyday fatigue. This lack of clear warning signs is precisely why CKD is often dubbed a silent killer. People can live for years with significantly reduced kidney function without even knowing it. By the time symptoms like swelling, fatigue, or changes in urination become noticeable, the disease has often advanced to later, more challenging stages. This makes routine screening and awareness of risk factors absolutely paramount. Now, let's tackle the question of why. What are the primary culprits behind this widespread condition? The two leading causes of CKD, accounting for the vast majority of cases, are diabetes and high blood pressure. Together, they form a formidable duo, relentlessly damaging the tiny blood vessels within the kidneys. Diabetes, particularly uncontrolled type 1 or type 2, causes high blood sugar that over time harms the delicate filtering units. Similarly, persistent high blood pressure puts immense strain on these same vessels, leading to scarring and reduced function. Understanding these primary drivers is crucial for both prevention and management. Beyond diabetes and hypertension, several other conditions can significantly increase one's risk of developing CKD. Polycystic kidney disease, for instance, is a genetic disorder where numerous cysts grow in the kidneys, enlarging them and impairing their function. Glomerulonephritis, an inflammation of the glomeruli, the tiny filters in the kidneys, can be triggered by infections or autoimmune diseases. Obstructive nephropathy, caused by blockages in the urinary tract from kidney stones, tumors, or an enlarged prostate, can also lead to kidney damage if left untreated. Each of these conditions presents unique challenges but ultimately converges on the same outcome: compromised kidney function. Other risk factors, though perhaps less direct, still play a significant role. Obesity, for example, is strongly linked to diabetes and hypertension, indirectly elevating CKD risk. Smoking damages blood vessels throughout the body, including those in the kidneys, and can accelerate kidney function decline. A family history of kidney disease suggests a genetic predisposition, making regular screening even more important. Age is also a factor, as kidney function naturally tends to decrease after about age 30, though not necessarily to pathological levels. Certain medications, especially prolonged use of NSAIDs like ibuprofen, can also harm kidneys over time. A combination of these factors often creates a perfect storm for CKD development. So, how is CKD actually diagnosed? Since early symptoms are elusive, diagnosis often relies on routine blood and urine tests. The most critical blood test measures creatinine, a waste product from muscle metabolism. From this, doctors calculate the estimated glomerular filtration rate, or eGFR, which indicates how well your kidneys are filtering. An eGFR below 60 ml/min/1.73 m superscript 2 for 3 months or more signals CKD. A urine test checks for albumin, a protein that shouldn't be present in significant amounts in urine. Its presence, called albuminuria, suggests kidney damage. Imaging tests like ultrasound can also reveal structural abnormalities. These diagnostic tools are vital for catching the disease early. Now, let's break down the journey of CKD into its 5 distinct stages. This staging system is crucial for understanding the severity of the disease, guiding treatment decisions, and predicting prognosis. It's primarily based on the eGFR, which, as we discussed, is the best indicator of kidney function. Each stage represents a progressively lower level of kidney function, with stage 1 being the mildest and stage 5 being the most severe. Think of it as a roadmap, showing how far the disease has progressed and what challenges lie ahead. Stage 1 CKD is often called kidney damage with normal or increased GFR. This means your eGFR is 90 or above, indicating good filtration. However, there are other signs of kidney damage present, such as protein in the urine, blood in the urine, or structural abnormalities like cysts on an ultrasound. At this stage, you typically won't experience any symptoms. The focus here is on identifying and managing the underlying cause, like controlling blood pressure or diabetes, to prevent further damage. Early intervention at stage 1 is paramount to slowing progression. Moving on to stage 2, which is mild reduction in GFR. Here, your eGFR falls into the range of 60 to 89 ml/min/1.73 m superscript 2. Similar to stage 1, symptoms are usually absent or very mild. The key difference is the confirmed reduction in filtration rate, even if slight. Diagnosis often still occurs incidentally during routine checkups for other conditions. The management strategy remains similar: aggressive control of risk factors and close monitoring of kidney function. Early detection at this stage offers significant opportunities to slow down the disease's progression and preserve remaining kidney function. Stage 3 CKD is where things start to become more concerning, categorized as moderate reduction in GFR. This stage is further divided into 3A, eGFR 45 to 59, and 3B, eGFR 30 to 44. Many individuals begin to experience symptoms at stage 3B, such as fatigue, swelling in hands and feet, changes in urination frequency, or difficulty concentrating. The kidneys are no longer efficiently removing waste, leading to a buildup of toxins. Management at this stage becomes more intensive, often involving dietary changes, medication adjustments, and more frequent monitoring by a nephrologist, a kidney specialist. Stage 4 CKD represents a severe reduction in GFR, with an eGFR between 15 and 29 ml/min/1.73 m superscript 2. At this point, symptoms are almost always present and can be quite debilitating. These include persistent fatigue, nausea, loss of appetite, bone pain, muscle cramps, and more pronounced swelling. The body's inability to balance electrolytes can lead to complications like anemia, bone disease, and heart problems. Stage 4 signifies that the kidneys are nearing failure, and discussions about future treatment options like dialysis or transplantation typically begin. Education and preparation for these life-sustaining therapies become critical. Finally, we reach stage 5 CKD, also known as end-stage renal disease or ESRD. Here, the eGFR drops below 15 ml/min/1.73 m superscript 2, meaning the kidneys have largely failed. They can no longer adequately perform their vital functions to sustain life. Symptoms are severe and life-threatening, including extreme fatigue, severe swelling, shortness of breath, vomiting, severe muscle cramps, and confusion. Without intervention, ESRD is fatal. At this stage, patients require either dialysis, artificial filtration of the blood, or a kidney transplant to survive. This is the culmination of the disease's progression, a critical juncture where immediate action is required. Managing CKD is a multifaceted approach centered around slowing progression, preventing complications, and alleviating symptoms. The cornerstone of treatment at all stages involves meticulous control of the underlying causes. For individuals with diabetes, this means strict blood sugar management through diet, exercise, and medication. For those with hypertension, it involves maintaining blood pressure within target ranges using antihypertensive drugs and lifestyle modifications. These foundational interventions are crucial, as they directly address the root causes of kidney damage and can significantly impact the disease's trajectory. Dietary modifications are also a cornerstone of CKD management, becoming progressively stricter in later stages. Initially, it might involve reducing sodium intake to control blood pressure and fluid retention. As kidney function declines, restrictions on protein intake may be advised to reduce the burden on the kidneys and minimize waste product accumulation. Potassium and phosphorus levels also need careful monitoring and restriction, as impaired kidneys struggle to excrete these minerals, potentially leading to dangerous levels. Working with a registered dietitian specializing in renal nutrition is essential to create a personalized, kidney-friendly meal plan that maintains adequate nutrition. Medications play a vital role in managing CKD and its complications. Angiotensin-converting enzyme inhibitors, or ACE inhibitors, and angiotensin receptor blockers, ARBs, are often prescribed because they help protect the kidneys by lowering blood pressure and reducing protein leakage into the urine. Diuretics may be used to manage fluid retention and swelling. Medications to control anemia, phosphorus levels, and bone disease are also common in later stages. It's a complex pharmacological regimen, often requiring multiple prescriptions to address the array of issues arising from compromised kidney function. When CKD progresses to stage 5, and the kidneys can no longer sustain life, renal replacement therapy becomes necessary. There are two primary options: dialysis and kidney transplantation. Dialysis is an artificial process that filters waste products and excess fluid from the blood when the kidneys can no longer do so. It's a life-sustaining treatment, but it's not a cure. Transplantation, on the other hand, involves surgically implanting a healthy kidney from a deceased or living donor, offering a chance at a much more normal life, free from the constraints of regular dialysis sessions. Dialysis comes in two main forms: hemodialysis and peritoneal dialysis. Hemodialysis involves diverting the patient's blood to a machine that filters out waste and excess fluid, returning clean blood to the body. This is typically done at a clinic several times a week for a few hours each session. Peritoneal dialysis uses the lining of the abdomen, the peritoneum, as a natural filter. A special solution is introduced into the abdominal cavity, which absorbs waste products and is then drained. This can often be done at home, giving patients more flexibility. Both methods are life-saving but come with their own benefits, challenges, and risks, requiring careful consideration. Kidney transplantation is often considered the optimal treatment for ESRD, offering a significant improvement in quality of life and life expectancy compared to long-term dialysis. A successful transplant means the new kidney takes over the filtering functions, allowing the patient to live a more active life, often free from dietary and fluid restrictions. However, transplantation is a major surgery with its own set of challenges, including the need for lifelong immunosuppressant medications to prevent rejection of the new organ, and the scarcity of donor kidneys. The journey to a transplant can be long, involving rigorous evaluation and a waiting list. Living with CKD, particularly in later stages, presents numerous challenges beyond medical treatments. The emotional and psychological toll can be immense. Patients often grapple with fatigue, dietary restrictions, frequent medical appointments, and the uncertainty of their condition. Depression and anxiety are common. It's crucial for patients to have a strong support system, family, friends, and support groups, and to seek mental health counseling if needed. A holistic approach to care recognizes that managing CKD extends far beyond just the physical symptoms, encompassing the patient's entire well-being. Preventing CKD, or at least slowing its progression, is undoubtedly the best approach. The strategies are largely aligned with managing its primary causes. Regular health checkups, even if you feel well, are crucial for early detection of risk factors like high blood pressure and diabetes. Lifestyle modifications form the bedrock of prevention, maintaining a healthy weight through balanced nutrition and regular physical activity, avoiding smoking, and limiting alcohol intake. These seemingly simple choices have a profound impact on kidney health and overall well-being, potentially saving you from the arduous journey of CKD. Controlling blood pressure is perhaps the single most impactful preventive measure. High blood pressure relentlessly damages the tiny blood vessels in the kidneys, leading to scarring and reduced filtration. Aim for blood pressure readings below 130/80 mmHg, or as recommended by your doctor. This often involves a combination of dietary changes, such as reducing sodium, regular exercise, stress management, and, if necessary, medication. Diligent blood pressure management not only protects your kidneys but also significantly reduces your risk of heart attack and stroke, highlighting its broad health benefits. Similarly, meticulous management of diabetes is paramount. Sustained high blood sugar levels are toxic to the delicate filtering units of the kidneys. If you have diabetes, work closely with your healthcare team to maintain your blood glucose levels within the target range. This includes adhering to your medication regimen, following a diabetic-friendly diet, and engaging in regular physical activity. Regular monitoring of HbA1c, a measure of long-term blood sugar control, is essential. Proactive diabetes management is a powerful shield against diabetic nephropathy, a leading cause of CKD. For those already diagnosed with CKD, even in early stages, close collaboration with a healthcare team is non-negotiable. This team typically includes your primary care physician, a nephrologist, a registered dietitian, and potentially other specialists. Regular monitoring of eGFR, blood pressure, and urine protein is essential to track the disease's progression. Adherence to prescribed medications, dietary recommendations, and lifestyle changes is crucial. Open communication with your doctors allows for timely adjustments to your treatment plan, ensuring the best possible outcomes and slowing the decline of kidney function. Understanding the role of certain medications is also vital. While some drugs are essential for managing CKD, others can be harmful. Non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen and naproxen, can be damaging to the kidneys, especially with long-term use or in individuals with pre-existing kidney conditions. Certain contrast dyes used in imaging procedures can also pose a risk. Always inform your doctor about all medications you are taking, including over-the-counter drugs and supplements, and discuss any new medications before starting them. Self-medication or ignoring potential drug interactions can have serious consequences for your kidneys. The journey with CKD can feel isolating, but remember, you are not alone. Seeking out and engaging with support groups, both online and in person, can provide invaluable emotional support, practical advice, and a sense of community. Sharing experiences with others who understand the challenges of living with kidney disease can reduce feelings of loneliness and empower you with coping strategies. Organizations dedicated to kidney health often provide resources, educational materials, and advocacy, connecting patients with the information and support they need. Research into CKD and its treatments is constantly evolving, offering new hope. Scientists are exploring novel drugs that specifically target mechanisms of kidney damage, beyond just blood pressure and blood sugar control. Advances in regenerative medicine, including stem cell therapies, hold promise for repairing damaged kidney tissue. Improved immunosuppressants are making kidney transplantation safer and more successful. This continuous quest for knowledge and innovation means that the future for CKD patients is brighter, with the potential for more effective therapies and eventually, even cures. Early detection is truly a game changer for CKD. The earlier the disease is identified, the more opportunities there are to implement effective interventions that can slow or even halt its progression. This means less damage to your kidneys, fewer complications, and a significantly better quality of life. Don't wait for symptoms to appear; by then, significant damage may have already occurred. Proactive screening, especially if you have risk factors like diabetes, hypertension, or a family history of kidney disease, is the most powerful tool you have. So, what are the key takeaways for you? First, know your risk factors. If you have diabetes, high blood pressure, or a family history of kidney disease, you are at increased risk. Second, get tested regularly. Simple blood and urine tests can reveal early signs of kidney damage. Third, adopt a kidney-friendly lifestyle, control your blood pressure and blood sugar, eat healthy, exercise, and avoid smoking. Fourth, work closely with your healthcare team and follow their recommendations. Empowerment through knowledge and proactive health management are your best defense against CKD. The kidneys are remarkable organs, tirelessly working to keep us healthy. They deserve our attention and care. Chronic kidney disease is a serious condition, but it's not a death sentence, especially with early detection and diligent management. By understanding its stages, causes, and available treatments, you empower yourself to protect these vital filters and lead a healthier, more fulfilling life. Don't let the silent killer catch you unaware. Be vigilant, be proactive, and prioritize your kidney health. Before we conclude, let's briefly touch upon the psychological aspect of receiving a CKD diagnosis. It's often overwhelming and can lead to feelings of fear, anger, or denial. It's perfectly normal to experience these emotions. Allow yourself time to process the news, but then channel that energy into learning and taking control. Knowledge is power, and understanding your condition is the first step towards effective management. Don't hesitate to ask your medical team questions, no matter how small they seem. Being an informed patient is your greatest asset in this journey. For those in later stages, particularly stage 4 and 5, the decisions regarding dialysis or transplantation are life-altering. It's essential to have candid conversations with your nephrologist about the pros and cons of each option, considering your personal health status, lifestyle, and preferences. Family involvement in these discussions is also highly recommended, as their support will be crucial. These are not easy choices, but making an informed decision, with all the necessary information and support, is vital for your long-term well-being and quality of life. Remember, the goal of CKD management is not just to extend life, but also to improve its quality. This involves not only medical treatments but also lifestyle adaptations that allow you to continue pursuing your passions and enjoying life. Whether it's finding kidney-friendly recipes that tantalize your taste buds, adapting your exercise routine, or staying connected with loved ones, maintaining a positive outlook and an active engagement with life are incredibly important. CKD is a part of your life, but it doesn't have to define your entire existence. The financial burden of CKD can also be substantial, especially for those requiring dialysis or transplantation. The costs of medication, frequent doctor visits, and specialized treatments can accumulate rapidly. It's important to understand your insurance coverage and explore any available financial assistance programs. Many national and local organizations offer support to CKD patients. Don't let financial concerns prevent you from seeking necessary care. Resources are often available to help alleviate some of this burden. Advocacy groups can also assist in navigating complex healthcare systems. In summary, chronic kidney disease is a complex and progressive condition that demands our attention. From the subtle signs of its early stages to the life-sustaining interventions of dialysis and transplantation, understanding CKD is the first step toward effective management and prevention. Your kidneys are indispensable, protect them. Be aware of the risks, seek early diagnosis, and embrace a proactive approach to health. It's a journey, but one that can be navigated successfully with knowledge, support, and diligent care. We hope this comprehensive overview has equipped you with a deeper understanding of chronic kidney disease. Your health is your most valuable asset, and being informed empowers you to make the best decisions for your well-being. If you found this video helpful, please like, share, and subscribe for more in-depth health content. And remember, always consult with a qualified healthcare professional for personalized medical advice regarding your condition. Your journey to better kidney health starts now. Thank you for watching.